So, hello, everybody. I am thrilled to be spending this time with you and moderating this conversation. I plan on providing you some very interesting dialogue tonight. Let me give you an outline of what it's going to look like and the time that we're going to be together so you can manage your schedule. The first thing we're going to do is we're going to be speaking about the health and program aspect of who we are and what we do. We're then going to take a brief break and we're going to migrate into having a discussion with people that are other healthcare professionals that are potentially wanting to work with our professional organization. But the first thing I'd like to do is I'd like to introduce myself. I am Jan Bloom and I am coming to you from Boca Raton, Florida. And I am thrilled to share this information because I have actually been affiliated with all of this information for over 2 decades. I just dated myself. I'll be sharing my story in a few minutes, but what I'd like to do is, speaking of sharing, I'd like to share my screen. And I'd like to share with you who we are, what we do, and probably give you a reason to understand why you've been invited here. So we are Health Practice Advisors. I am the founder and CEO of Health Practice Advisors. I developed this organization more than 15 years ago, and I have been affiliated with the same company that we are partnered with for 30 years. I'm not new to this conversation. I feel very much an expert in this dialogue, and I want you to know the reason that I am here after all these years is these 3 reasons, because nothing feels better in life than helping people feel better, look better, and live better, and get messages every day of gratitude. And so we are a group of healthcare and fitness professionals. We are also comprised of many people that are health enthusiasts, fitness enthusiasts, and just people that are health obsessed. And so what we're sharing with you tonight is not trendy information. It's not anything that's gimmicky or fad-like. I developed the integrative medicine program for our brand partner over these last 20 plus years. I work with cardiologists, endocrinologists, internists, OBGYNs. I work with gastroenterologists, holistic healthcare professionals, bariatric surgeons. I work with every specialty that you could possibly name to me. And the reason I work with them is because of the credentials that we have, the opportunities that we help healthcare providers provide to their clients and their patients, and the chance for people that are in the fitness field to expand their dialogue with their fitness clients and incorporate a very important element, which is the health element. So regardless of how you were invited here tonight, whether it was from a health coach, a physician, a fitness professional, or just a good friend that's a super obsessed health and fitness enthusiast, you are definitely in the right place at the right time. So I'd like to share with my story with you, and I would like to share it with you because everybody has a reason why they're here when working with us. And for me, it was to prevent history from repeating itself. These are my in-laws that you see on your screen. My father-in-law died of a massive heart attack on an airplane coming home from a very happy family event. In that family was a significant amount of cardiovascular disease, high cholesterol, diabetes. Every man never exceeded the age of 65. They either had a stroke or a heart attack. Well, those genetics, my father-in-law generously passed on to my handsome husband, who happens to be a medical doctor. And I'm not sharing that with you because being a medical doctor is so phenomenal. It's hard work. I'm sharing it with you that is because even though he knows everything to do properly, medically, and eating healthily and clean, he still inherited those same genetics from his dad and got that exceedingly high cholesterol and had to be on the highest dosages of medications to keep it controlled to prevent history from repeating itself. I was really grateful when we had children and our daughters were 6 and 8 years old, that our physician, pediatrician said, you know what, with the kind of family history that your husband has, it might be a good idea to get a baseline of their lab chemistry. Let's make sure they didn't inherit his genetics of that cardiovascular disease, because if they did, you need to know about it now while they're young. Well, what a blessing it was to have that pediatrician have the wisdom to make that recommendation, because typically they do not check cholesterols or metabolic profiles on little kids. And we found out that Amy and Suzanne at 6 and 8 years old had cholesterols that already exceeded 400. Needless to say, that should tell you why I got engaged in this field of nutrition and health. But I am thrilled to tell you that my daughters are now healthily in their 30s, best friends, had their first set of babies at the same age, the same time within weeks of each other, and just had their second set of babies within weeks of each other. And what we're going to be discussing tonight is going to be what I was introduced to all those years ago when I learned that devastating news that those girls had that cholesterol and were also borderline diabetic. So let's move forward. When that pediatrician explained the numbers to me, I didn't understand it. It was more of the visual that hit home for me. It was a visual like what you see right now. He said, basically, your daughters have the arteries at 6 and 8 years old of a 30-year-old. That took my breath away. Look at this graphic. Look at what the plaque buildup is of a 30-year-old, and they've got it at 6 and 8 years old. Can you only imagine what that cholesterol and plaque buildup would have been when they were 15, 18, 20, and 25? Thank God I learned about this when they were little girls. So what you're going to hear about tonight is exactly what I heard about and what they have been implementing into their lives all these years to this day, and what compelled me, because of their profound improved results, to migrate into a direction of nutritional health at a time when nobody even believed something like that made sense, even my own husband. But you know, when I was learning about what you see on the screen, I was really compelled to do deep research, because I knew at the end of the day, I was going to be facing a classically trained MD husband who would look at me when I talked to him about this like I was coming from outer space. And he did. But he couldn't argue with me, because I said, you know what? What the girls are going to use is something that has dramatic amounts of research. Double-blind, placebo-controlled studies. Those are the kind of studies that are done by pharmaceutical companies. Studies that got published in major peer-reviewed medical journals. That means cardiology journals, internal medicine journals, endocrinology journals, and published in the Physician's Desk Reference, the Bible to the medical community. Imagine that one little packet can do so much. One little packet for $1.87 can lower cholesterol and stabilize blood sugar and do so many other things you're going to learn about tonight. But the studies were profound. The fact that it didn't just lower cholesterol, but the study showed how it increased HDL, which is your good cholesterol, and lowered LDL, which is your bad cholesterol. There's never been a pharmaceutical drug that can do that. In fact, I cannot tell you, over my 20 plus years with this company, how many pharmaceutical companies have been interested in buying us because they wanted this formulation, because there is nothing else like it on the planet. Our company developed it at Stanford University. They had already been doing research on it 3 years before I learned about it. And we own the exclusive patents and distribution rights to this. So nobody can ever say, oh, I could find something like that at CVS. Oh, I can get that at Costco or Walmart or Sam's Club or the pharmacy. No, you cannot. Period. So share this with you with intense passion, because I want you to understand how life-changing and life-saving it is. The physician's desk reference that I mentioned a couple minutes ago literally is the Bible to the medical community. So frequently, when you go to the doctor and they're writing you a prescription, many of them are getting so many new drugs promoted to them every single day that they aren't familiar with them. And the drug reps have to come in and explain everything to them. And then they can't remember half the things that the drug reps told them because they've been just seeing 20 or 30 patients that day. So what do? They say to the patient, I'm going to prescribe for you. I'll be right back in. And then they run back in their office. They open up the big book, which is the PDR, to quickly look up that particular medication so they can then see what are the side effects, what are the interactions, what are the adverse effects of this, what are the reasons. I mean, they have to literally go and read it in the book because they can't remember everything that the drug rep told them. So when you have something that's published in the physician's desk reference, that's powerful. And you know that nutritional supplementation is typically not published in the physician's desk reference. It can only be published when it meets a certain criteria of science and research that has been conducted. So I wanted you to understand these credentials. Now, when I was learning about how this could save my children, I needed to learn about it from a very kindergarten perspective because I'm a visual person. So this is all I needed to hear was that they were going to shake this up in some cold water. It was going to taste yummy like a glass of orange juice, and it was going to block the absorption of sugar and cholesterol in their GI tract. It was going to slow down the absorption of sugar that was getting into their bloodstream from whatever foods they were eating. It was going to reduce the cholesterol that was produced by their liver, which is the genetic factor that they suffered from, and it would enhance the enzymatic breakdown of that bad cholesterol, the LDL. This was very clear to me when I looked at the diagram and I understood what that diagram represented. But genetics are not the only problem. There's more than 11 companies that are feeding us and killing us, and they're earning trillions of dollars at our expense. And so one of the reasons so many health coaches and medical professionals are attracted to who we are and what we do is because we prefer to teach the fact that food is fuel, and food can fuel you or food can kill you. And we are educators, and we want to educate people and let them know how critical it is to pay attention to the different foods that are slowly taking you down. People are unhealthy and they don't feel great these days, whether it's because of poor food choices, the stress, not that we live in an easy world today, the sedentary lifestyle, the underlying health conditions that we have, the negative mental attitudes, people can't sleep, people aren't hydrated. Everything you see on your screen are contributing to why people don't feel great. And so we're going to be addressing that. We're going to show you how we literally bridge the gap, which is what needs to be done, which is why the healthcare professionals enjoy working with us and endorse who we are, as well as the fitness professionals, because people are in a current state of premature death. Culturally, ethnically, some people are more predisposed to cardiovascular disease than others. It isn't always just lifestyle driven. Sometimes it's culturally driven. But what's very interesting culturally and ethnically, regardless of who you are and what your genetics and background are, you know what? We don't eat to live. We live to eat. When we celebrate life, we do it over food. It's a bottom line. And that food is what puts us in our current state of poor health. And we need an action plan that makes sense for each of us individually to get to our desired state of good health. And so we have a protocol, and it's called the Feel Great Protocol. And the reason it's called that is because when people were implementing this protocol into their lives, everybody kept saying the same thing. They kept saying, you know what, I just feel great. And for that reason, the marketing department said, why should we come up with a name that people won't understand? Why don't we just say it like it is? People feel great. Let's just call this the Feel Great Protocol. And then we'll integrate the education alongside it. So the Feel Great protocol we're going to talk about for the next few minutes is 2 supplements and 1 practice. And the 2 supplements come in these skinny little packets, and they produce extraordinary, not just measurable, extraordinary results that are mind-boggling. You can only imagine, in all of my years of working here, the stories that I've heard are endless, from PCOS to cholesterol, diabetes, extraordinary fat loss, weight loss, fibromyalgia, gout improvements, unbelievable stories that are unexpected and in so many cases anecdotal, and in many cases measurable with lab results. I can tell you that what we're talking about tonight is not on trial. Nobody should leave this conversation and say, well, let me see if it works. This is not on trial. What you're seeing here has been out for years. It's been proven over and over again, and not just here in the United States, in 50 countries. So let's talk about this Feel Great protocol and what it includes. It includes the 2 components that I shared with you, and let's look at the benefits. The balance is what brought me into this whole environment. It improves blood sugar, so it addresses diabetes and prediabetes. It facilitates fat loss, which people literally are craving to accomplish. It improves bowel regularity, which is why so many gastroenterologists work with us, and healthy digestion. It provides prolonged satiety. Everybody's always hungry all the time, whether you're a stress eater or you just have nothing to do and all we do is think about food. You don't when you're utilizing this because you always feel satiated. It prevents weight gain. How many times have you lost weight and gained it again? It lowers cholesterol, as I shared with you with my daughters who are now within a normal range with their cholesterol, with their blood sugar. It eliminates bloating. How many of us women deal with the bloating as we get another year older and another year older, and balancing our hormones? Oh my gosh, how does it do that? Because the multiple ingredients that are in the balance have the ability to absorb excess hormones that are in our system that are only causing havoc in our system. But you know what? I don't care how healthy something is for you. If it doesn't taste good, we're not going to use it. So I want you to know it tastes great. And if you want to know what's in it, it's 5 different sources of soluble and insoluble fibers. It's fortified with calcium, B vitamins, plant stanols, plant sterols, and all of these healthy plant-based nutritional ingredients that are missing in your everyday diet. What people are so obsessed with today that makes me nuts is carbohydrates, carbohydrates, carbohydrates. You know what your obsession needs to be? Your obsession needs to be fiber. How much fiber are you taking in every day? Because fiber and lack of it is the root cause of almost every single problem that you see listed on that page in front of you. If you would just have a high intake of fiber, 30 to 35 grams of fiber a day, that alone will solve the majority of your problems. But the problem with just having fiber from your foods is you can't get that. You'd have to have 16 heads of lettuce to get 30 grams of fiber. Also, it's the kinds of fiber that you need to have in your system that are not found in your everyday foods, which is why the types of fibers that are in this packet are the types of fibers you will not find in your foods. But when you integrate this and just add that to your everyday regimen, now you're going to put yourself in a very safe health envelope that's going to address all of your concerns, whether it's your women's health concerns from perimenopause to menopause, to your joint pain and your inflammation, to your metabolic health and your chemistry. Now we add the next component, the Unimate. This is an extraordinary supplement because it's all about the cognitive function. It's all about the brain and the gut connection. It's all about helping people accomplish having a healthy microbiome when you've got a good, healthy sense of balance of bacteria in your gut. Your gut has good bacteria and it has bad bacteria. And what the balance here does is it takes care of the bad bacteria and helps promote the good bacteria. And the Unimate does the same things when it comes to your insulin levels, when it comes to your cognitive function. It eliminates all cravings and hunger. It eliminates all of the anxiety and mood depression feelings that you're going to have. When you use this, you literally will notice an uptick in your mood. You will notice an insane amount of focus that it's as if someone turned a light on in your brain. It's not uncomfortable. It's not an energetic feeling that makes you feel uneasy with palpitations or anything like that. It's just this unbelievable awareness that you will notice slowly creeping up on you. And so while you see everything on the screen about how it helps to accelerate the fat loss and how it helps to support ketone production and tastes great, all of these things, when combined together, when these two are merged together and then merged into your life with your lifestyle, whether it's an active one or a sedentary one, or whether you're a good eater, clean eater, or a poor eater, when you merge this into your world, changes happen. I can tell you over and over again, I hear these stories, and that's why I can speak with such authority. The practice part of the protocol is something called intermittent fasting. And a lot of people say, oh, no, I can't fast. I got to wake up and I got to have food in the morning. So maybe you do. So do it. We don't say you have to do this practice, but I'll tell you what happens. When you merge this into your world, all of a sudden, that need to wake up in the morning and have something to eat right away starts to dissipate. For some reason, the combination makes those cravings, those needs start to get diluted and diminished. And it makes the lifestyle changes and habit changes that we're teaching you, it makes those changes come easier to you. And intermittent fasting can be very adjustable. It doesn't have to be one way or the highway. But what's important to know is it has a lot of benefits health-wise. There's a lot of studies to back up intermittent fasting, from diabetes to improving your cardiovascular health to improving your gut microbiome. And as I said, it's flexible. You can literally just do intermittent fasting along with whatever your background is and the way you live your life, whether you work at night or you work days or you're an eater at crazy hours, you figure out how you're going to intermittent fast in your world. Practice is easy. Now, before I spoke about how the Unimate and the balance together affect mood, our company spends millions and millions of dollars on doing primary research. What's primary research? That's the kind of research that you do on your actual supplements, your actual ingredients, not borrowing studies from 14 different places and then putting them together and calling it your study. It's when you do university-driven studies at highly credentialed institutions and that those studies get published. And so at the prestigious Oxford University study, there at university, they did the happiness study. They wanted to see how does this affect people's mood? And the outcome was the overall well-being increased by 75% after 30 and 60 days using this Feel Great protocol. People noticed a significant improvement in their mood balance scores. So just saying, don't take my word for it. There's clinical trials that back it up. Our scientific credibility is off the chain. First of all, this is really important for you to know. When you look at the nutritional world and you go to the GNC stores or you go to the vitamin aisle in Costco, Sam's Club, or any store, there's hundreds and hundreds of nutritional supplements. The nutritional supplement industry is not regulated by the FDA. That means you don't know if what's in the bottle is on the label, and you don't know if what's on the label is in the bottle. You're taking their word for it. Most companies will produce products and white label them and put this company's label on it. And then they'll take that same product and put another company's label on it. And you got the same product from 15 different companies. It's all packaging and labeling. And all the companies that are nutritionally driven are packagers and relabelers. That's not who we are. We source our own ingredients worldwide. We manufacture all of our own supplements. Nobody else does. Nothing is sent out and contracted anywhere else. So when it appears from the dirt in the ground to that manufacturing facility, we have had control of every single ingredient from the moment birth was given to that first leaf that popped out on that plant from the ground. And we have and own fields all over the world. And then, as if that's not impressive enough, the fact that we have done over 50 clinical trials at major universities and hospitals. Talk about the Cleveland Clinic. Have you heard of the Cleveland Clinic? It is the #1 heart hospital in the United States. People fly in from all over the world to go to the Cleveland Clinic. And that's where our studies were conducted, published in major peer-reviewed medical journals. Are you really going to argue with me about this? You shouldn't, because we have all the credibility right here.
Good morning, Dr.
How about this?
Love having you. So there are reports of people experiencing.
Does Ozempic look familiar to you? Are you seeing it on TV? Are you watching the commercials? Can you sing the song in your sleep? This upsets me. It upsets me because it shows the desperation of the patients, the clients, the public to lose weight. They will go to any extreme financially or risking their own health just to lose weight. And I can tell you, it blows my mind because it's so dangerous and it doesn't work. I'll tell you a story that just within this last week, I encountered the acquaintance of a woman who, where I live, went on the Ozempic. She lost a tremendous amount of size. Great results. But you got to get off it at some point. Fortunately, she didn't get sick or anything on it. But once she got off of it, everything came back, and didn't just come back, it came back ×2. And now she's in conversation with us. And now we're helping her. And I'm going to explain to you after you watch this scary brief video how we're helping.
Good morning, Dr. Sutton. Always love having you. So there are reports of people experiencing so-called stomach paralysis. What is that? And what should we know about these side effect claims?
So good morning, Janae. So stomach paralysis associated with these medications, Ozempic and Wegovy. So one of the methods that these medications work is that they slow the rate at which food empties out of the stomach, or they have something called gastric delay. This helps with feelings of fullness and helping to suppress appetite. Now we're seeing these isolated reports of patients who are suffering from stomach muscle paralysis, where food cannot empty out of the stomach. We define this as called gastroparesis, and it can be associated with symptoms of abdominal pain, bloating, acid reflux or GERD, and severe nausea and vomiting. And Janae, I've taken care of patients who suffer from this diagnosis. It is absolutely brutal. Patients often come in with severe dehydration and electrolyte abnormalities, and many have their symptoms are so difficult to control that they have to be admitted to the hospital.
So I want to share with you why it's critical for you to know how we're addressing this. The Feel Great protocol is a dynamic duo because what it does is completely opposite of what Ozempic does and all of the semaglutide drugs that are out there that people are desperately using and spending a fortune for. The medications take your GLP-1 hormone, which is the hormone that tells your brain that you're full, you're not hungry, and it helps to control the appetite and the cravings. And what it does is it takes that hormone and it puts it to sleep. When it puts it to sleep, it's the drug that's enabling you to feel no more cravings, appetite to be gone. Then the balance, what that does is it does exactly what the Ozempic does. It makes you feel full, it satiates you, but it does not stop the gastric emptying. If anything, it improves your digestion. It makes it more efficient. And the Unimate illuminates and takes the GLP-1 hormone that's in your body, your own hormone that is saying you're hungry or you're not hungry, or you want this to eat, but you don't want this to eat. The Unimate is illuminating that GLP-1 hormone, your own hormone, naturally. It's not putting it to sleep. So the woman that I've encountered over this past week that I shared with you, she is on this system, and her results are probably going to be a little bit delayed because her GLP-1 hormone is sound asleep from being on the drug as long as she was. And so she will get results by being on the system. But for the people that find us before they jump onto these drugs for weight loss and fat loss, lucky them, because we're going to give them all of those same exact benefits, the appetite control, the satiety, the digestion, everything the drug does. We're going to do it nutritionally, naturally, holistically, where you provide nothing but health benefits, not detrimental negative side effects. So this is a reason I work with several physicians. Specifically, I work with OBGYNs who are dealing with many women that have babies and want to lose the baby weight. And they quickly say, "Oh, I want to go on the Ozempic." I'm working with OBGYNs that are saying, no, you're not. And they're putting them on this. In fact, I work with several OBGYNs who recommend the balance for every pregnant person to prevent the onset of gestational diabetes. I work with gastroenterologists who are dealing with patients that have severe gastrointestinal issues. I work with cardiologists who are dealing constantly having to put people on higher and higher dosages of medications because their obesity, their excessive body weight is elevating their blood pressure, elevating their cholesterol and triglycerides. But by utilizing this combination, it's killing 10 birds with one stone. It's bringing down the blood pressure, it's bringing down the cholesterol, it's normalizing the sugar, and it's helping them feel satiated, and it's taking away their cravings. It's extraordinary. The amount of health benefits that people get, some people say it's too good to be true. Sounds like it is. I know it does, but it's true. There are so many people with real results and real results. And these are real people with real results. You know why? These are my girlfriends. Do you know what it's like to get a girlfriend to listen to you? But I have girlfriends that are having extraordinary experiences, from weight loss to bowel improvement to better sleep to PCOS problems being solved to people losing weight when they never could. Some of my girlfriends that are in the menopause and losing weight is horrific for them. The stories are endless. And I can tell you, not just girls that are my age, but even young gals like Marley, who is my daughter's sister-in-law. A tiny little thing. The fact that she lost 4 pounds in a week, and this is a huge coffee drinker, this gal, couldn't believe that going on this protocol yielded those results. And then this other lady who lives across the street from me, Pam, got her blood test results, and it's the first time in 15 years that her A1C is in normal range, and she lost 9 pounds. She said, wow, that balance really works. The stories are endless. And when your close friends begin to see their own results, it just opens up the floodgates for one referral after another referral after another referral. And I think that's why I don't have a life where I live anymore, because the referrals are nonstop. You can actually ask the coaches that know me and work with me. Every other day, I'm sending them copies of texts. Oh my gosh, another referral. I don't know what to do with this, because I am not used to doing health coaching. That's not what I do. I work in the whole medical realm with the physicians and the program development. So anyway, there are so many stories, but the best story is my own story. Guess what? Even though I've always eaten healthy and clean, COVID hit all of us. And for that year of COVID, I said, I'm just living life. I'm going to eat everything I want. I want chicken parmesan. I want Burger King. I want pizza. I don't care. I'm going off of supplementation. I just need a break. I've always paid attention to my health. Look what happened because I took that break. I jumped up to 169 pounds. I then, for the first time in my life, had high cholesterol, high LDL, blood sugar out of whack. And then I got that blood test result and I said, oh my gosh, that's it. That's my wake up call. I got to get back on the horse. And thank God I did. And I went back and just added this to my regimen. It took me off of my mind of eating the way I was eating poorly during COVID. I put on over 30 pounds in a year. And then you can see now my last visit was in August. And now I'm down a couple more pounds and I've got total normal lab results. So I'm guilty too, but I wanted to share my own experience so you could see that even when you know how to eat healthy and clean, we're all guilty. We all fall off the rocker. But all I did was get back on the wagon, and those are the results. I think it would be kind of cool for you to hear some of the people that I know. We were at an event and they shared their results. So I think it will be good for you to hear the diversity of the different things so you're not hearing it from just me.
Alessandra, you still on metformin? What were you struggling with? Gone?
Fine.
Alexis, what happened to your pre-diabetes?
Gone.
How much weight are you down?
Down.
Misha, how much weight are you down?
Down.
What happened to your arthritis?
Gone.
Diabetes?
Gone.
Boom. Jose, what happened to your diabetes?
Gone.
How much weight are you down?
16 pounds.
What was your A1C before?
8.5.
Now?
6.4.
Boom. Shannon, show me those biceps. Use the Feel Great system? Boom. Chris, what happened to your high blood pressure?
Gone.
How much weight are you down?
25 pounds.
Boom. Cesar, what happened to you with the Feel Great system?
Antidepressants. I'm down 24 pounds.
Boom. And that was Jamie last August. Jamie, that's insane.
The last time I ordered soup was 10 years ago. And you were 40 months. I was doing a cabbage soup diet and lost a bunch of weight. Now, I eat what the hell I like, and I use this.
And no cabbage soup. Boom. Farah, how much weight you down? And all you're doing is taking a balance. And look, everyone's just mixing balance. Simple. Steph, how much weight are you down? We got Kronk beat the beaties. Keith, what happened to your A1C?
A1C went from 11.8 guys all the way down to 5.5. So totally off the chart diabetic to non-diabetic anyway.
Insane. We got Joel. What happened to your diabetes?
All right, I went from 7.6 to 5.3. Blood tested this last Monday. I've gone down to 47 and a half pounds in about 100 days.
Oh,
How much more do I need to say? You can absolutely listen to more stories. Just find it all over the internet. You're going to hear one story after another. So as I said before, we're not on trial. This has been proven, and you can take that to the bank. So I'd like to talk about why diets don't work. And that's because they're just not sustainable long term. Some of these commercial things that you see on your screen, many of you might have tried some of these things. You know that you're never going to follow through, and it's not going to be long term for you to maintain a lifestyle with any of these. What's great is all those people that you saw drinking the balance, it's so easy. You shake it up in a bottle of water, drink it before a meal. If you forget, drink it after the meal. The food is still in your gut, but when you drink it before that meal, it fills your gut and it literally expands 15 times. Now, you don't feel that 15-time expansion. It's not uncomfortable for you, but it's taking up space in your gut, which is why when you sit down to eat the things that you enjoy, you won't be able to eat as much. So it helps you reduce your caloric intake. And then all those fibers I talked about in here, that's what slows down the absorption of sugar into your bloodstream. And that sugar is only feeding your fat cell. So This is easy, this is sustainable, and this is something you do alongside your healthy eating, not all this nonsense you see on the screen. What works is implementing the nutrition that's missing from your diet, which is the extraordinary amount of fiber that you need. You need habit changes that will just be itty bitty habit changes that don't make you feel like you're being deprived. You need food as fuel, and that mindset starting to understand that food is fuel. You can actually feel great from food, but it's killing you if you don't start to pay attention. And you need to implement some physical activity that you enjoy. I mean, I'm not a gym rat and I don't even like working out. I'm the person that looks for the treadmill that's directly under the ceiling fan because I hate to sweat. But when you find something physical that you like, whether it's walking your dog down the street to the corner and walking back, that's physical activity, whatever it's going to take to get you physically active a little bit. The better you feel, the more you'll want to do. That's what works. Small, itty bitty changes. So one of the things that we take pride in is when you work with us, we're not just about, okay, take these products, good luck, do what you want. That's what my doctors do. My doctors have no time in the exam room to sit and explain lifestyle changes and habit changes. They just say, look, I don't want to put you on blood pressure medicine. I don't want to put you on a statin. I don't want to put you on metformin. I want you to utilize this. I'll see you back here in 4 to 5 weeks. We'll check your labs. They don't even talk to them about the lifestyle or habit changes. But you know what? People come back in the 4 to 6 weeks, get their lab work, and it's improved. Unbelievable. Even with no habit changes, people see improvements. But if you want real change, make some of the changes that you get taught, that we teach you with our educational component, because we are educators. At Health Practice Advisors, we're advising people about the right health practices that you need to implement into your life. And so we have a program that's called Get Fit 21. That doesn't mean you're going to become Miss America or Mr. America in 21 days. It just means that we're following the theory that it takes 21 days to form or break a habit. And that doesn't mean in 21 days you're going to have mastered everything. Some people will go through our Get Fit program. We've had people stay in it for as long as 2 years because they love it. We've had people be in it for months at a time. We've had people that we've told, okay, good job, you're doing enough. And they say, no, I don't want to stop, because they love to be connected to it. It keeps them in a healthy mindset. So for those of you that love the education, or for those of you that love providing education, Get Fit 21 is extraordinary. And it's a medically endorsed program because we have so many physicians that refer their patients to this program because they don't have the time in the exam room. So we are teaching this concept of lifestyle education, and we do it in conjunction with the global leader in metabolic health intervention, who produces our Balance and our Unimate. So let's talk a little bit about it. The Get Fit 21, again, had a clinical trial done proving the relevance of implementing this nutritional supplementation into a 90-day educational coaching program. And the outcomes were extraordinary in improving cholesterol, triglycerides, blood sugar, hemoglobin A1C, fat loss, weight loss. Amazing. So clinical trials backing it up. It's proven. It was launched in 2013. The education with supplementation is definitely the key to our success. We have health coaches that put many of their clients into this program. We have health coaches that will enjoy putting their own programs with this. Any educational program is wonderful. We just found that the Get Fit 21 is so simple, so kindergarten, very good for me, ADD friendly. It's just easy. And the fact that it's endorsed by the medical and the holistic community, and it's affordable. What did I say before? $1.87 a packet. I mean, for those of you that are Starbucks drinkers, give me a break. What do you spend on a Starbucks if you get one of those lattes? I'm not a Starbucks person because the line is always too long at the drive-thru, but I can tell you I'm not spending $5 on a cup of coffee. But people do every single day. What does that mean? If someone's spending 5 hours a day on a Starbucks, times 30 days in a month. It's $150 a month on a Starbucks coffee. It's insane, but people spend it. Just like people are insanely spending that $1,000 a month for the Ozempics. We provide incredible client education tools, simple, easy tools that can just be emailed as a PDF, tools that talk about metabolic health or blood sugar, food guides, glycemic index. We teach people everything in the most simplified way. We make this a complete no-brainer. We have so many physicians that endorse who we are and what we do, and that's because the results they're seeing when their patients come back for their lab tests, they can't argue with it. You can't argue with a lab test when the cholesterol was 300 in August and then it's down to 140 in December. Can't argue with a blood test. It's not somebody saying, oh, my cholesterol dropped. It's a measured result on a lab test. That's why so many healthcare professionals have worked with us all these years. The certified coaches that work with us are extraordinary women. They come from a variety of backgrounds in fitness, in women's health, in diabetes, in fat loss and weight loss, and social work and cognitive and gut health. I mean, we have so many health coaches that are just beautiful, wonderful, lovely women. And we have some guys too. They kind of do their own thing. But the fact that we are so diverse ethnically, culturally, in fitness, personal trainers, you are in such good hands when you work with any one of us that are in health practice advisors. And if you've been invited to this conversation by a health coach or a physician or whoever brought you here, thank them, because this is the best information and gift you're ever going to get. Hey, the holidays, when they come around every year, people are so quick to go and spend so much money on materialistic nonsense. Let me tell you something. The best thing I believe people can give someone during the holidays is a gift of health. It's the best, because good people don't keep important information a secret from people they care about. So what I'd like to do is tell you a little more, and then I want you to hear from a few of these coaches. First of all, the Get Fit program, if you just want to learn a little bit about how to be healthier in your life, you've got different ways you can accomplish that. You can be part of our private Facebook group where it's just clients and patients that are in this group. And every day there's a post and information on an audio. You can listen to it. You can read it. Everybody likes to learn different ways. You can be part of that group and kind of share it. Listen, misery loves company. If you're in there because you want to lose weight, it's fun to see what other people are doing because in there, they're maybe sharing and posting. So that's kind of cool. Then there's the personality who says, no, I don't want to go to Facebook group. Just send me the information. We have a whole automated email program that we can send you the lessons and everything privately just to you in your inbox through our email program. And again, it could be something to read, something to hear, something to see. We have a women's health support group that's unbelievable. And every one of you that's a woman should be subscribing to our Feel Great for Mid-Age private Facebook group. Please subscribe to it. The content, the stories, the information is unbelievable. You can ask questions. You can get free information. You don't have to go and pay for a doctor's office visit. You might be able to get the information that you need without even having to go see the doctor or just get educated. So being part of our women's health support group, whether you're postpartum, perimenopause, or menopause, is something you want to definitely tap into. I always tell people the first step to getting anywhere is deciding that you are not willing to stay where you are. If you're here as a patient, as a client, I can tell you there's nothing you can do better for yourself than get your hands on what we talked about tonight. And so what I want to do is I'm going to stop sharing for a minute, and I'm going to ask a few women to kind of share their perspective. I'm going to call their names out so they can prepare themselves to chat, because it always takes a minute to find the mute button. So I'd like to, first I'm going to be calling on Debbie Sacco. I'm going to ask Juanita Hales. I'm going to ask Trisha Donaldson. I want to ask Rakesha McMillan to share their thoughts. I'd like to hear from Melissa Tippy. I would like for you women to share anything that you think is noteworthy for people, whether they are a patient, a client, what you think means the most as a health coach, as a fitness professional, whatever your background is, I'd like you to share it. And so I'll call, now that I gave you all a chance to get out of mute, if I called your name, you should be out of mute. And I'm going to start with Rakisha McMillan.
Yeah, thank you so much, Jan. I think for me, being in the social work profession, that I needed something to be able to support my clients in a very integrative way, and I just didn't have that. Not only does the Feel Great system support physical health, it supports mental health, emotional health, providing a comprehensive program for my clients. And it has produced life-changing results where I've had women get off of as many as 23 medications, 20 medications, women who have lost over 40 pounds. And it is just a phenomenal thing to witness, because I've been a social worker for over 20 years and I have not come across anything like this, to where it has not only been beneficial for my clients, but it has helped to expand my business in ways that I never thought possible. So it is a win-win for the professional. It is a win-win for the clients. It's just unbelievable what is possible.
And Rakisha is more than just a social worker working with our veterans. She is also a retired Air Force veteran. Thank you for your service. And also, she is a certified integrative nutrition health coach, a graduate of IIN, which is a very prestigious health coaching program. So she knows her nutrition. And the last thing she was going to do was compromise her credentials when she was looking at different things that she could do to implement into her client practice. So, Keisha, you're very humble, but I had to give you the little bit of shout out for who you are and what you didn't share.
Thanks.
Deb Sacco, I'm going to call on you, if I may, and ask if you would share something that you feel is noteworthy that I may have neglected to mention, or that you have been so impressed with, or anything.
Okay, well, honestly, a lot of you don't know this, but you may figure it out. In the beginning, when I first started with this company, I was using the Unamate mostly, and I wasn't using the balance, but the Unamate by itself still was a big effect on me because I had a lot of brain fog. And I was very, so to speak, flighty. A lot of things were going on that I was not up to par with anymore. So once I got on the balance and the Unamate together, I felt the inflammation in my body really subside. I have an autoimmune disease, so with that comes a lot of inflammation, and you just never know when you flare up. So honestly, for me, the inflammation has really made a huge impact, especially when I can put my pants on and find out that I've lost almost 3/4 of an inch on each calf. That is huge for me because I have done everything under the sun that you could name, and nothing, absolutely nothing worked. This did. So for me, that is the hugest thing that I have found.
You know, it's interesting, and I'm so happy for you. Debbie is also highly credentialed, a graduate of the Integrative Nutrition program and certified health coach. Again, another health coach who would not compromise her credentials if this weren't a noteworthy program and whole nutrition plan. But when you hear her say, and I lost 3/4 of an inch on each calf, and for a moment I wanted to laugh, and I'm thinking, I don't want to lose weight in my calves. I want to lose it in my butt and my thighs. But then I'm thinking, oh, she said 3/4 of an inch on her calves because that was all inflammation. And so that's what she meant, because at first I'm thinking, what? So now I understand what you mean, Debbie.
Well, it's really hard to put pants on when your calves are bigger than the pants are.
That's why they invented leggings, I guess.
Yeah, true.
Thanks for sharing. I appreciate that. You see, it's interesting. I told you, we hear all these different unique stories as a result of people utilizing. They go on this for one reason and then something else happens. Do you think that she started the Feel Great system because she says, I need to lose inches in my calves? Oh, but that's what happened as a side benefit. So thanks, Deb. Trisha Donaldson, if you don't mind, you're a personal fitness trainer. You've got more credentials from all these different, I can't even keep track of all the different associations and certifications that you have. Can you talk about what's impressed you from a personal fitness, athletic type of perspective and health perspective?
Yes, absolutely. How's everyone doing tonight? You know, guys, I've been a trainer for about 22 years and I found myself very frustrated one day. I said, I need to be doing more than just giving somebody a good workout. A lot of my clients would come to me upset and depressed, and I really wanted to help them. And that's why I found this company. Unimate is such an amazing supplement. It is the only supplement that gets me going in the morning and gets me out the door at 5:30 a.m. to do my cardio and to do my strength training. Listen, I realize nobody is going to come work out with me if they're in bed and they're sluggish and fatigued and they have problems getting out of bed, right? So this is where the Unimate comes in. I also I was a fitness competitor for about 4 years. During that fitness training, I literally for 3 months straight could only eat tilapia and asparagus because you have to get lean on stage. Well, long story short is that gave me a really bad eating disorder. So after that, I really was such an emotional binge eater. I promise you guys, when I started the balance in the Unimate, I have not binged in about a year because these supplements really keep you full. Listen, binging is, it's emotional. Well, we are all emotional eaters. When we eat when we're sad, we eat when we're lonely, we eat when we're tired, we eat when we're bored. That's all emotions, right? But these supplements, they keep you full. They really help that GLP-1 hormone. And all of my clients, whether they're eating healthy or not eating healthy, they are seeing results. One thing I also want to emphasize, guys, is let's not think of this as an on and off system. That's when we get into trouble. Like I'm on the program today, I'm off the program today. These supplements, I think of them as my vitamins. I take them every single day because if you don't take them every day, they're not going to work. They're amazing. And I'm so happy that I found Health Practice Advisors, and I'm here for the long run.
Trisha, thank you so much. And I want to say you made a very important point. I just had that dialogue with somebody. Somebody said to me, I sometimes forget to use it. And I said to her, then take it when you remember. I said, let me ask you, do you brush your teeth every day and do you shower every day? Yeah. So then you just drink this every day. You make it part of your world. It fills the gaps. And when you just said that every single day, it just becomes a part of what you do. How many of you remember 1-a-day vitamins? You would take 1 a day. It just becomes part of your world. And so you just reallocate whatever time it's taking you to drink your Unimate or your balance. You reallocate that 1 minute from doing something else to drinking that. No different than brushing your teeth every day. You will feel better. You will look better. You will live better. You're going to get all the benefits that we're talking about tonight. Trish, thanks for bringing light to the everyday part, because the only time, everybody, that this does not work for somebody is when it stays in the box, period. Perhaps I can ask Melissa Tippy to share. I know Melissa Tippy has also passions of her own as a certified integrative nutrition health coach. And I'm mentioning it in advance just in case she also doesn't mention it. Graduate of IIN and passionate, I know, about women's health, passionate as a diabetes educator. Melissa, give us your comment on what you think is important.
Well, as a health coach, Jan, what really impressed me about Health Practice Advisors was the education and what the program was putting out about metabolic health and cutting edge as far as the conventional medicine. So that really, the education that we put out is phenomenal and top rate. Personally, the Feel Great system has changed my life. It's changed many people's lives in my life. I've watched it change lives. And my personal experience, as many of the women on here know, I lost 22 inches in 5 months, 13 pounds, and I haven't found anything quite as remarkable that can literally make you look like a completely different person and literally make you feel completely different from the inside out. And I am passionate about women's health, and I am passionate about the Unamate and just the effects it's had on hormonal balance, mood swings, hot flashes, and everything else. And I know that's way more than one thing, but it's just all in one. How's that?
It's great. And I appreciate you illuminating the fact that it does address the women's health and the hormones and the hot flashes and everything that we all get. So, battle of the air conditioning thermostat in my house, no more. So, thank you, Melissa. Juanita Hales, if you could share your thoughts when you're not in the mute phase and give a comment or two on what has illuminated you with this whole thing.
So I was not a health coach when I came here, and nor did I want to be one, to tell you the truth. But my family and I came here morbidly obese, and we had tried several times to lose weight. We would yo-yo. We would lose weight, gain weight, lose weight, gain weight, and just nothing was sustainable for us. And so every time we would go to gear up to lose weight, they put me in charge. And then I would lead my family through all them complaining and not having education. And it was so nice to be able to come into Get Fit 21 and have certified Get Fit 21 coaches to lead me and my family and to teach me. And just the supplements were wonderful. The group was wonderful. I still am committed to the group. And we even have people that come back. We'll have people that fall off the wagon, like you were saying during COVID, and came back to us. So I love that we have these programs. Supplementation is absolutely fantastic. And each and every one of my family members has lost over 100 pounds and maintained that weight loss. I no longer fear that they're going to get diabetes. I no longer fear that they're going to have heart attacks and swelling in their face, just all the things that I saw some of my other family members go through.
So, saving your family's life, how do you put a price on that? And how do you put a price on your health? And so, on that note, I want to talk about what is your health worth to you? Because that's where you look at, well, how am I going to allocate the funds to invest in myself? So, I always say to the patients, to the physicians, how their nurses are going to convey, how does their patient get this? When it comes to acquiring the coaching services that you might be working with your coach on, that's one thing. When it comes to acquiring the supplementation, that's simple. This is provided for you to have a 90-day protocol because everybody has a different chemistry. Everybody's metabolism is different. Everybody's way that they're going to respond is going to be different. I know people that in the first day say to me, is this my imagination or am I really feeling this insane focus? I've had people say at the end of 4 days, like you saw right in the review that we did tonight, I've had people lose 4 pounds in a week. I mean, the stories are endless, but everybody has a different experience. So we found that the 90-day protocol is fair for everybody because it gives everybody a long enough time to get the experience that they're seeking. So for you, it could be a week, it could be a month, it could be 5 weeks, but in 90 days, we know someone's going to get a result. And if they don't, there's a 90-day money back guarantee. So you can't go wrong. For somebody to be utilizing the whole package where they literally send you 1 month at a time, and then they send you the next month when your first month runs out, because once you start, you don't want it to leave your system. You run out and say, oh my gosh, I need more. So the company will send it to you just at about the time you're going to need your next month for that 90 days. And that way it's already been built up in your system, your body's used to it, and you stay on the protocol. So the company will send it to you once each month. You will get billed at that time. And each time they bill you, you'll get a reduced fee because you're on the 90-day protocol versus paying a fee that is just one time. So you're out of pocket for somebody who's just ordering a Feel Great package would typically be $169 plus $10 for shipping. But the people that follow the protocol and do it correctly, they get an additional $10 discount. So their out of pocket is $159 for 60 packets of Unimate and 30 packets of Balance. And then they get free shipping. And then the company sends them a free, beautiful bottle. And the company sends them a free, unbelievable hand mixer. So when you're out in public at a restaurant, you have a hand mixer to make it easy for you to use. So you get all these perks and you get your own free member account. And there are so many loyalty benefits when you are on the protocol that the company provides to you. So my advice to you is you're never going to know unless you try. Talk to who has asked you to review this and say, I need to try that, because you'll never know what could have been unless you do. And so I invite you to please not wait for the person who told you about this to get back to you. Show them the initiative and the respect, and you get back to them and shoot a text when you log out of this and just say, I want to connect. Let's talk tomorrow, or let's talk tonight, whatever is convenient. That's your next step as a guest here tonight, is to be responsible, be professional, be respectful, and you text the person who invited you here tonight before they text you. Let's see who reaches who first. So on that note, I'd like to thank those of you that were guests here tonight to learn about our Feel Great protocol, working with health practice advisors. And it will be just taking a 2-minute break. And then I'm going to come back and have a brief chat with a handful of coaches. And for those of you that are coaches looking to potentially know more about the opportunity of working with us, I'll be spending a few minutes on that as well. So thank you all. And if you need to log out, my feelings won't be hurt. Thank you.